Hey, everybody, and welcome back to Study Nurse IQ. I'm Jeannie, and today we're going to dive into a more advanced skill: how to perform an indwelling catheterization for a male patient, which you might also know as a Foley catheter insertion. We're going to go through this step by step with a full demonstration so you know exactly how to execute this critical, sterile procedure safely. First, let's talk about the supplies. Before I ever enter the patient's room, I have my hands washed and I've gathered everything I need. That includes a Foley catheter kit, a separate package of clean gloves for initial perineal care, some disposable washcloths, and a Foley catheter anchor. The anchor is a critical piece of equipment that we'll discuss in detail later. I also have a garbage can ready at the side of the bed. All right, I'm now entering the patient's room. Hi, sir. My name is Jenny, and I'll be your nurse today. I have an order to insert a catheter to help drain your bladder. This will help relieve some of the pressure you've been feeling. My patient today is Mr. Peter. I'll ask him, can you please state your full name and date of birth for me? I'll confirm that with his ID band to ensure I have the right patient. Now that I've confirmed your identity, I need to make sure you're comfortable with the procedure. Mr. Peter, the doctor has ordered this catheter to help relieve the pressure in your bladder. It will help you feel more comfortable. Is it okay if we proceed with this now? Once he gives his consent, I'll say, great. For your privacy, I'm just going to close the door and pull the curtain around the bed. Next, I'll raise the bed to a comfortable working height for me, typically around my waist. This is for my body mechanics, so I don't hurt my back. I'll also reposition Mr. Peter by having him lay flat with his legs slightly bent and apart if he is able. This gives me plenty of room to work. Now we're ready for the first step: perineal care. This is a clean, not sterile procedure, so I'll put on my clean gloves. Mr. Peter, I'm just going to cleanse your genital area now. The water may feel a little cold. It's vital that the urinary meatus, the opening where the catheter will be inserted, is as clean as possible. For an uncircumcised patient, you must gently retract the foreskin to expose the meatus and properly cleanse the area. If you don't do this, the meatus will be covered and you won't be able to insert the catheter safely. You may have to use your fingers to hold the foreskin back. Once the area is clean, I'll discard my clean gloves and wash my hands. Before I begin, I'll prepare my Foley catheter anchor. The one I have is a Velcro anchor, and I'm just going to wrap it loosely around the upper third of Mr. Peter's thigh. This is a great way to set myself up for success and prevent me from breaking my sterile field later. Now I'll open my Foley kit. I'm going to open the package away from me, being careful to only touch the 1-inch outer border. My sterile gloves are on top, so I will put those on first. Now that my hands are sterile, I can touch the inside of the kit. Inside the kit, I'll pull out the sterile drapes. I'll use the larger flat drape first, placing it under the patient's hips. Then I'll take the fenestrated drape, which has an opening in the middle, and I'll place that over Mr. Peter's genitals, exposing only the area I'll be working on. Now it's time to get the rest of my sterile supplies ready. I'll open up the betadine swabs, squeezing the fluid onto the cotton swabs inside. I'll also squeeze the sterile lubricant into the tray. I'll take the pre-filled syringe that comes in the kit, which contains sterile water, and pull back on the plunger until I see a small air bubble. I don't need to recap the syringe, as it's sterile to sterile. Finally, I'll make sure the protective sheath is off the catheter, and I'll place the tip of the catheter into the lubricant in the tray, so it's ready to go. Okay, everything is set up. Now I'm going to take my non-dominant sterile hand and grasp Mr. Peter's penis, holding it at a 90-degree angle. This is a critical step because it straightens out the male urethra, making insertion much easier. My non-dominant hand is now considered dirty. I'll use my dominant hand, which is still sterile, to cleanse the meatus with my betadine swabs. Starting at the meatus, I'll cleanse in a circular, downward motion. I'll use one swab for each pass and then discard the dirty swab into my trash can at waist height. I'll use a minimum of 3 swabs to ensure the area is clean. Once the area is clean, I'll take the lubricated catheter with my dominant hand. Mr. Peter, I'm going to insert the catheter now. You may feel some pressure, but it should not be painful. Please take a deep breath and exhale slowly. I will gently insert the catheter until I see urine begin to flow into the collection bag. Then, I'll continue to advance it until it reaches the bifurcation where the tubing splits into the balloon port and the drainage tubing. The reason we go this far is because the male urethra is long, and we want to ensure the balloon is inflated safely inside the bladder and not inside the urethra, which could cause significant injury. Now, with the catheter fully inserted, I'll use my non-dominant dirty hand to hold it in place. Using my now free dominant hand, I'll take the pre-filled syringe and connect it to the balloon port. I'll then slowly inflate the balloon with the full 10 milliliters of sterile water. Once it's inflated, I'll keep my thumb on the plunger as I disconnect the syringe to prevent the water from backflowing. I'll then gently pull back on the catheter until I feel the balloon settle at the neck of the bladder. The sterile part of the procedure is now complete. I'll take off my sterile gloves, wash my hands, and put on a new pair of clean gloves. I'll now anchor the catheter to the anchor I placed on Mr. Peters' thigh. The anchor is designed so that if the tubing is pulled, it pulls on the anchor and not on the catheter itself, which prevents urethral trauma. Finally, I will make sure there are no dependent loops in the tubing and that the drainage bag is secured to the bed frame, not the bed rail, so it doesn't get tangled or pulled when the bed is moved. The drainage bag must always be below the level of the bladder. Afterward, I'll perform a final perineal cleansing with a fresh washcloth to remove any residual lubricant or antiseptic. I'll reposition Mr. Peter, lower the bed for his safety, and then I will document the procedure, including the size of the catheter, the amount of urine obtained, and the patient's tolerance. Now that you've seen the full procedure from start to finish, let's try some pop quiz questions to test our knowledge and make sure everything sticks. Question 1. A nurse is preparing to insert an indwelling catheter into an uncircumcised male patient. Which action is the most critical step to ensure proper cleansing of the urinary meatus? Using a minimum of 3 antiseptic swabs. B. Holding the penis at a 90-degree angle to the abdomen. C. Retracting the foreskin before cleansing. D. Discarding each used swab into a sterile container. Rationale. For an uncircumcised male, the foreskin must be retracted to expose the meatus and allow for proper cleansing of the urethral opening and glands. Failure to do so would prevent adequate disinfection, increasing the risk of infection. Question 2. A nurse is inserting an indwelling catheter into a male patient. The nurse continues to advance the catheter after seeing urine return. What is the rationale for this action? A. To allow for sterile collection of a urine sample. B. To prevent the catheter balloon from being inflated within the urethra. C. To ensure the catheter reaches the full length of the bladder. To make it easier to secure the catheter to the patient's leg. Rationale. The male urethra is approximately 6 to 8 inches long. Advancing the catheter to the bifurcation, even after urine return is seen, ensures the catheter tip is fully within the bladder. Inflating the balloon while it is still in the urethra can cause severe trauma and bleeding. Question 3. During an indwelling catheterization procedure, a nurse's dominant hand accidentally touches the patient's thigh after cleansing the meatus with a sterile swab. What is the most appropriate nursing action to take next? A. Continue the procedure, as the patient's skin is considered clean. B. Change gloves and restart the procedure from the cleansing step. C. Discard the current catheter and use a new one from the kit. D. Stop the procedure and inform the charge nurse of the contamination. Answer B. Change gloves and restart the procedure from the cleansing step. Rationale. The dominant hand, which is considered sterile, touched a non-sterile surface, the patient's thigh, thus contaminating the glove. To maintain sterile technique and prevent infection, the nurse must discard the contaminated gloves, open a new sterile glove package, don the new gloves, and repeat the cleansing process before inserting the catheter. Remember, a Foley insertion is more than a checklist. It's about patient dignity, infection prevention, and accurate sterile technique. Mastering it with this demonstration builds the confidence you'll need in real practice. If this video was helpful, like and subscribe to my YouTube channel at Study Nurse IQ. Thank you.